Okay, so good morning, good afternoon, good evening to everybody, wherever you're joining us from in the world, and a very warm welcome to this afternoon's discussion on global solutions to confront substandard and falsified COVID-19 vaccines. My name's Adam Aspinall. It's my great privilege to be chair of the Fight the Fakes Alliance. In my day job, I'm in charge of the access and product management for the uncomplicated malaria portfolio at Medicines for Malaria Venture. And malaria is, as many of you will know, something which is very, very much affected by the scourge of fake and substandard medicines. I've just seen a message to say that people can't hear me speaking. Can somebody tell me if I'm coming through?
We can hear you.
Okay, great. Some people say that's a disadvantage. Okay, so the Fight the Fakes Alliance is a multi-stakeholder non-profit association, and our aim is to raise awareness and influence change about the proliferation of substandard and falsified medicines. And in fact, we've just been very glad to celebrate our 1-year anniversary as a formal non-profit organization. We actually started back in 2013 as a loose association of interested organizations from a very disparate range of backgrounds and different industries, academia. Everybody had the same basic motivation, which is they recognized the scourge of falsified and substandard medicines and wanted to find a way to do something about it. This is actually the first event in many events in the 4th Fight the Fakes week. So we're delighted that this is the kickoff for that week. The Fight the Fakes week was born from an initiative to create awareness about substandard and fake medicines, not only to the general public, but also throughout our own networks and staff and our family and friends. And throughout the years, we've been involved in many events, lectures, booths, documentary screenings, debates, exhibitions, town hall events, and all sorts of other activities organized by our members, aiming to bring more attention to the issues. As you can imagine, over the last 18 months, it's been pretty challenging to organize in-person activities because of the pandemic, but we are still very much present with the campaign online. And the theme of this year's Fight the Fakes week is health is not a hoax. And this year we're calling on people to become fake busters in their own right, in their own situations and workplaces, since that's where everyone can play a part individually. So today's discussion on global solutions to confront substandard and falsified vaccines is especially timely because, as we've all seen, the pandemic has been really a huge opportunity for counterfeiters to falsify all COVID-related medical products and PPE, and particularly now vaccines. And if there's one thing that we've learned, in case we didn't already know, during that time, is that the counterfeiters are incredibly creative, they are very innovative, they can move very fast, and for them, the COVID-19 pandemic represents a massive opportunity to make money. In fact, Interpol has described the pandemic as the new liquid gold for counterfeiters who exploit people's fear, the inequalities, to make money regardless of the fact that they're killing people in the process. So I'm sure, like me, you're keen to find out what the experts have to say about this problem and also about the solutions. But before we move into the discussion, I'd just like to start by saying a huge thank you to the organizers for all their work in pulling together today's program, to the incredible panel of speakers that have agreed to take part, and to our moderator, Sirisha Yadlapalli, who's Vice President, International Government and Regulatory Affairs at the US Pharmacopoeia. And USP is a hugely valued member of the Fight the Fakes Alliance. So in her role, Sirisha oversees USP's work with regulators and policymakers around the world, as well as with multilateral organizations such as the WHO, PAHO, and APEC, and so on, in order to help improve global health through public standards and to build trust in the supply of safe, quality medicines. Sirisha, we're really glad to have you today to moderate such a timely discussion. So with that, I'll hand over to you. Thank you.
Thank you so much, Adam. Good morning, good afternoon, and good evening to all of our speakers and audiences who are calling in from around the world. Pleasure to have you with us. We have all been seeing how critical, why this discussion right now is so critical. Adam just gave a great context, and speaking from having seen certain things in person in one of the regions in India. So through, I was heading USP South Asia, based out of India for the last many years. And during the second wave in April and May of earlier this year, we saw tremendous number of instances where remdesivir and other treatments were falsified, where vaccines began to show up, falsified vaccines began to show up, and these have been in the news, and increasing instances of these across the globe. So very timely discussion, very important discussion, with billions more doses that are needed to be able to protect the population of the world, and the demand supply being such a gap. Clearly the threat is increasing. And today we have panelists from across the world who are working on this issue from different aspects, and we're happy to welcome each of them. We have Ms. Pernette Bordelais-Esteve, who is from the World Health Organization and works on incidents and substandard falsified medical products, regulation and safety. Dr. Yvette Madrid, Vaccines Program Director at US Pharmacopoeia's Global Health Division. Dr. John Hertig, Vice Chair and Associate Professor, Department of Pharmacy Practice, Butler University College of Pharmacy and Health Sciences. Ms. Oksana Pajek, Global Engagement Lead and Lecturer in Global Health at the UCL School of Pharmacy, Research and Department of Practice and Policy. And Ms. Maria Fernanda Hurtado, International Policy and Operations Director from the Latin American Federation of the Pharmaceutical Industry, FIPharma. Thank you so much for joining us today, and welcome. I do have just a couple of housekeeping things to mention for our audience. All of the biographies for our speakers are on the event page at Fight the Fakes, and our organizers will post the link as well on chat. If you'd like to, please, I encourage you to know more about our speakers and their backgrounds and the experience they bring and the perspective they bring to this discussion. We have the Q&A and the chat box are open and visible throughout the event. Feel free to put in your questions either for specific speakers or to the panel in general. We also have a Spanish interpretation available. So please click on the world icon at the bottom of the window to choose the Spanish interpretation. You may also want to mute the regional audio to hear the interpretation better. And with that, I request all of our panelists to switch on their videos, and we can get started. Thank you for joining us. So we start with Pernette. Can you hear me and see me okay, Pernette? Yes.
I can hear you and I can see you. Is it the same on your side?
Yes. Yes. Okay, so we are familiar with some of the initiatives that the World Health Organization has been taken up to tackle substandard and falsified medicines, and now with vaccines as well. What more can you tell us with these latest developments, with the increased deliberate falsification of COVID-19 related products? Could you share your thoughts, please?
Thank you very much, Sirisha. So WHO has been collecting qualitative and quantitative data on the issue of substandard and falsified medical products for a decade now. And the objective is to better understand the scope, scale, and harm caused and there will never be enough data. There is a continuous need for data and evidence in order to promote better informed decision making at the member states level. And this is something that we can see very much at play with the COVID-19 pandemic. So we've had a lot of qualitative analysis of this data that we receive and that we hold, and it's allowed us to establish 3 major driving forces of substandard and falsified medical products. The first is poor governance. It's not hierarchical, it's just so you've got poor governance, constrained access, and weak technical capacity. And what's really interesting is we can see that each one of those forces has been exacerbated by the COVID-19 pandemic, each in different ways, but you can see that different countries will be more or less vulnerable to those different threats. So in some countries, it's a technical capacity in terms of sensitization and awareness, not my problem approach, but they will not realize that we live in a globalized world and they might be exposed to that threat as well. In other countries, it's the constrained access, the shortages, which is going to be driving things far more. And in others, it's going to be corruption or other traditional governance driving forces. But what I would like to say is, in WHO's work to respond to this threat, we've put together with the member states a holistic strategy of prevention, detection, and response. And this strategy has got 12 functions, and those 12 functions can only be realized or implemented through multi-stakeholder collaboration with a lot of different stakeholders, with a lot of different actors, which is why I'm so pleased to participate at an event today like those with Fight the Fakes, because education and sensitization, awareness raising is one of the core functions under the prevention pillar. But additionally, it's important to remember that a lot of those functions fall under the mandate of national regulatory authorities. And these public health authorities play an absolutely essential role in shaping and executing policies that ensure access to medical products. But there is no access unless it's access to quality, safe, efficacious, and affordable medical products. There's no point investing so much in access if it's to get a substandard or a falsified version at the end. So equitable access requires combating substandard and falsified medical products. And this means transferring technologies. It means increasing manufacturing capacities. It means addressing all the access issues, but it also means addressing all the governance issues and all the technical capacity issues. So I'll stop here and I'll add on in the panel so I don't eat up the time of my co-panelists.
Thank you, Pranay. Could you expand a little bit more on the point of COVID vaccines and therapeutics being more susceptible to falsification and becoming substandard? How is this related to the trust in the healthcare system and medicines? If you could expand on that a little more.
Absolutely. So with the COVID vaccines, medicines and vaccines and other medical devices are not a commodity like any other. They have to be regulated in very particular ways. We have to make sure that they are of the appropriate quality and the appropriate safety before they're put onto the market. The COVID-19 vaccines in particular present the additional complication of having very complex supply chains. Some of them will be in the deep cold supply chain. So imagine a very globalized supply chain where you've got an increasing number of transactions and an increasing number of stakeholders whom you must all oversee as the product comes closer and closer to the patient. So at the beginning of any product's life cycle, there's a limited number of transactions and a limited number of stakeholders who come into play. But as the product gets manufactured, receives regulatory approvals and authorizations, as it gets imported, exported, as it is circulated in the normal global marketplace, you have an increasing number of stakeholders and it's moving closer and closer to the patient. So everything must be controlled, and that's more and more difficult for the same authorities. The other thing with vaccines, and you've mentioned it, is trust. Now, I started my intervention by saying that data is very, very important. Without data, we don't have science. It's no more complicated than that. data is a little bit more than just the science, because we live in a world where data is dynamic and it will drive some of our behaviors. We can see it with algorithms, but that's a separate debate. If there is one commodity, I think, in today's world, which is maybe more valuable than data, it's trust. And there's a very wide variety of socioeconomic impacts of substandard and falsified medical products. Of course, you'll have increased morbidity and increased mortality. If people are not receiving the products that are supposed to make them feel well, they're going to stay sick, and they're going to stay sick for longer. And it'll probably contribute to antimicrobial resistance. But what it will also do in terms of the wider socioeconomic impact is it will undermine trust in the systems, whether it's the private or the public systems, which was supposed to supply them with what they asked for. The deal is broken. You went to your supplier, you asked for something, and you got ripped off. And whether you perceive that supplier to be the government or the private pharmacist in your neighborhood, it doesn't matter. There's been a breach in the contract. And once trust is broken, it's very, very difficult to build it up again. And we can see it in the COVID-19 pandemic, that there is a link between countries where there's low vaccination uptake and low trust in government systems. It's something that's applicable to all vaccine policies, not just COVID-19. It's very important that public health officials are trusted. It's very important that scientists are trusted. But if we tell people, take this vaccine, and at the end of the day, they have a substandard or a falsified version, what do we have to fall back on? It undermines all of our investments in access to safe, equitable, affordable, and quality medical products.
That's great. Thank you, Pernette. So we will move to Yvette.
Thank you, Sirisha, and thank you to the Fight the Fakes organization for having me. I'm going to echo and maybe take off from some of the points that Pernette highlighted. So, I'll start with a point that she really made about the importance of data. And it is the source upon which we can take action. So it's difficult to understand what to do if we don't have an understanding of the problem. But I'm going to touch on an issue that is a bit of a pain point for some, and that's sometimes we don't actually want to know we have a problem, right? It's easier to sort of pretend that everything is okay, and especially when the stakes are high, it becomes even more of an incentive to want to put our heads in the sand. So there can be complacency around gathering data, and even fear around gathering it, because nobody wants to look like they're the ones with the problem. The fact of the matter is that the problem is everywhere. So it's not about pointing fingers at anyone. It is about acknowledging that the issue is a global one. It's everywhere. And that the first step to being able to tackle it is to know. Ignorance is not bliss. It's not innocuous. And pretending that there isn't an issue has a price to be paid, and it's a steep price. Because in fact, if you're delivering SF products, substandard or falsified vaccines, for example, it's actually worse than delivering nothing. Why? Because people think they're protected when they're not. So they'll change their behaviors accordingly. And they'll be exposed to the virus in ways that when they think they're protected, and so all of these efforts to expand access mean nothing if you're not expanding access to a right product of quality, right? There's a price for individuals and a price for society, and Pernette touched on the trust issue, which is very important. One of the reasons that sometimes countries, regulators hesitate to really fully explore this issue is fear of stoking vaccine hesitancy. But not doing anything about it can also backfire and further stoke that vaccine hesitancy. So the fear of hesitancy really shouldn't be a reason not to try to gather the data. It is a very strong reason to have very effective communication around what is taking place and why people can trust the vaccines and what the governments and others are doing to ensure that the supply is safe, and that includes the surveillance activities. So yes, how do we collect that data then? We've been talking a lot about it. How do we collect it? Well, there's certainly passive reporting, and these are just events that people think are suspicious, and these can be the public, or it can be healthcare workers or workers in the supply chain. Reporting anything that they see as suspicious. It's very important to have those mechanisms known and available for anyone to be able to report anything. But there are also methods that are more effective in terms of being able to understand the scope or scale of the issue and identify more precisely what is taking place. And those that often relies on active surveillance. And the issue, one of the challenges, of course, is that many countries, many situations are resource constrained. So it's very hard to take representative samples of vaccines, for example, but it can apply to other products while a pandemic is taking place, right? So at USP, we promote, and this is through the PQM Plus program that is funded by USAID, an approach called risk-based post-market surveillance. And here the activities of sample collection are really focused on the highest risk products in the highest risk areas and in the highest risk facilities. And this can yield, with significantly less resources, evidence that is comparable to full-scale post-market surveillance. But whatever it is, I've been talking a lot about the detection and collecting the data. It's important to remember that, that all of the actions need to be viewed as part of a comprehensive system. It's not enough just to detect. It's important to see it's linked. So the prevention, the detection, and the response, and to take actions across the full range.
Thank you, Yvette. Could you expand a little bit on the point you made about improving communication, and where is the biggest need for improving that communication, and also who has the power to protect and implement these measures against substandard and falsified vaccines?
Well, I'll start with who has the power, and the regulators have a key role, but they're not the only ones. This is a partnership effort, because you have to have law enforcement, and you need to bring in, a whole set of stakeholders to act together. But regulators clearly have a fundamental role in this. Then, with regards to communication, it needs to be tailored, right, to audiences and to needs. So for the public, I think the key there's key communication around where it is that they can safely access vaccine. Different countries have different channels of supply. In some countries, it's only public sector and no internet sales, etc. In other countries, it's different. But clear communication for each country around what are the official channels where and places where the individuals can access vaccine and where they cannot, because clearly if you're accessing it from a supply source that is not publicly authorized, you're going to have a problem, right, with the vaccine. So there's communication around that. For healthcare workers and workers in the supply chain, there can be communication around how to detect falsified vaccine, and you can have things like visual inspection guides where you have pictures of what the product should look like correctly, against some examples of some falsified vaccines, so that they become more sensitized to understanding what exactly looks right and isn't. It's not foolproof, but it's a step. Communication around how to check if lot numbers are valid in that country, and also around disposing, for example, vials of COVID-19 vaccines, so they can't be reused. So there's communication that's very tailored to that audience. And then I think broadly there should be knowledge about how to report into the passive system, and that goes across the board. Public and healthcare workers. And I think the communication around trust and the activities taken to minimize falsified and substandard vaccine should be communicated not as a reason not to trust, but as a reason to trust. And there, people, like to see the picture that they see, but there's a clear link to saying, yes, we are taking active steps to ensure that the vaccine you take is the right one. So when you go and you receive it, you should trust it, you can trust it, right? And it's about building that trust through communication.
That's a great point. It's a reason to do more of it versus not. Could you also share if there are communities that you feel are the more affected by substandard and falsified COVID vaccines than others?
Well, this is a global problem, and even within countries, anybody can be affected. And sometimes, you could see wealthier communities targeted because they might have money and be willing to pay to maybe get ahead of the queue, if you want, and end up with falsified vaccine. But where where there's really strong concerns, I think, are the typically marginalized communities, because they have less resources at their disposal to first understand if there's a problem, and to be able to respond to issues if there are. Vaccine might possibly be more likely to reach them under substandard and falsified conditions. And it's really a question of equity of access, right? To make sure that even in the hardest to reach places, in the places that typically suffer more from falsified products, that they can receive as good a vaccine as anyone else in the world, right? Quality is fundamentally an equity issue. And so we need to view it from that lens as well.
Thank you so much, Yvette. Quality is fundamentally an equity issue. Great point. Thank you. Before we move on to John, I just want to remind our audience that we have been sharing a lot of links that are relevant that the speakers have been referring to, and other relevant links in the chat screen. So if you are not seeing the chat screen, I would encourage you to look at all of the relevant reports and links to more depth of the topics we're talking about. Thank you. John, you bring a great perspective to this discussion. Can you share a little bit about the behaviors of consumers and healthcare professionals when it comes to COVID products, including vaccines?
Yes, thank you, Sirisha, and thank you to the organizers. Absolutely, and my comments will focus also on the role the internet has related to this issue. As other panelists have perfectly articulated, maintaining the integrity of the pharmaceutical supply chain is absolutely critical to providing safe and effective medicines for everyone. Reports suggest that SF and counterfeit antibiotics, lifestyle drugs, painkillers are most targeted by counterfeiters, yet categories of pharmaceuticals targeted by these criminals does continue to expand, including more expensive specialty therapies and vaccines. Our global supply chains are increasingly complex, and external threats, including the importation of SF medicines, internet commerce, as well as expanding gray markets, are challenging the resiliency of our safeguards. These threats result in unsafe and ineffective medicine entering our supply chain. Naturally, fear and uncertainty, as other panelists have described, does drive consumer behavior, with counterfeiting criminals exploiting weaknesses in our fragmented supply chains. Consumer-driven e-commerce, pervasive internet access has only furthered the distribution of these products, both legitimate but also counterfeit online. Bolstered by the ability to remain anonymous behind a veil of web addresses on the freely accessible surface web or on the covert dark web, counterfeiters gain easy access into global markets. Meanwhile, our consumers consistently demonstrate a willingness to take risks when purchasing medicine and products online, disregarding consequences of these purchases from unknown sources. Online purchases have an appeal for a variety of reasons, which many of you are familiar with, including speed and convenience, potential cost savings, avoiding discussing sensitive conditions, and a frequent absence of a prescription or other regulatory requirement. At any one time, there is an estimated 35,000 to 40,000 active online pharmacies, with 600 added every single month. Due in part to the COVID-19 pandemic, United States studies assert a significant increase, greater than fourfold, in the number of people buying medicines online today. The COVID-19 pandemic and other public health emergencies expose patient safety issues that arise when fear and misunderstanding, as well as misinformation, drive patients to purchase untested treatments and cures via the web. As I mentioned, this is especially true in the context of the ongoing pandemic. COVID-19 tests, treatments, and especially vaccines have been found widely available via the internet and social media. In fact, within weeks of the WHO declaring the COVID-19 pandemic, 100,000 new domain names were registered containing the terms COVID or corona or virus. Of these, 122 contain the string vaccine, and over 400 contain the string test, much before legitimate vaccines and tests were available. One of my research studies in 2020 was a 10-year systematic literature review, which focused on documented harm from illegal sales of medicine. That study found that medicine on shortage, that was restricted or on recalled status, was highly referenced in the literature as correlated to increased morbidity and mortality. No surprise that difficult to find COVID-19 vaccines are then counterfeited and made available via the web. Now, fortunately, there are many active collaborative efforts to combat this global patient safety threat. As pharmacists, and I'm a licensed pharmacist, we serve as the medication use experts for our communities, and our ability to identify and counsel on illegal websites and SF medical products is essential for mitigating harm in our communities. In addition to meaningful efforts like this one, the Fight the Fakes Alliance, as well as the International Pharmaceutical Federation, there are lots of resources available to guard against this and assist in our identification of illegal online pharmacies, including tools offered by a company called LegitScript, and we can include this information in the chat, as well as the National Association of Boards of Pharmacy, or NABP. That NABP organization here in the United States has also established what is known as the .Pharmacy Verified Websites program that provides opportunities for pharmacists and consumers to purchase only from reputable sources. Other organizations like the Alliance for Safe Online Pharmacies Global, which I'm privileged to chair, have resources and tools available to help inform health professionals and keep patients safe when buying vaccines or getting access to vaccines. So as I close my remarks, despite these collaborative efforts, we still have significant work ahead of us. Increased compulsory education requirements, training, continuing education modules are needed globally to ensure that the profession and the global healthcare community has the capacity to understand and take action on this issue. Further and vitally important, we must always ask our patients, where do you get your medicine? Where are you getting your vaccine? Have you gotten your vaccine, to help intervene if you think you're going to get a medicine or a vaccine from a questionable source? And then lastly, as others have mentioned, additional research into the prevalence and impact of illegal online distribution of vaccines is essential to protecting the public health from this threat worldwide. Thank you so much for this opportunity, and I'm looking forward to the questions that come.
Thank you so much, John. Can you hear me?
I can.
Yeah. Those are staggering numbers, statistics, and the thousands of domain names, and much before tests were available, vaccines were available, illegal online pharmacies. Those are really staggering, but it's also interesting to note that consumers were turning to social media to actually purchase, and that's That's interesting when vaccines have been in shortage in most countries and they're only available through the government and through official sources. So for something that is being organized so extensively by the government that consumers would choose to go online and do this is surprising. It's also dangerous. So what are some of the trends you're seeing and what are some of the solutions that you might have to suggest?
Yeah, I appreciate that question. And other panelists have so rightfully identified fear and lack of trust as a main driver. I mean, it's the same reason we go online for many products, is we feel like we can't get it, whether it's a holiday present or whether it's a medical product. You know, we want it first. And so that drives consumer behavior in terms of purchasing products online, including vaccination. And it's not just COVID-19 vaccination, it's other vaccines as well. What we're seeing, unfortunately, is a shift, especially within our younger population, in purchasing products via social media, which is, you know, even more difficult to regulate compared to the internet and traditional web-based platforms. We completed a recent study here, which was United States focused, so I will put a little bit of a caveat around it, but we looked at about 1,000 younger individuals and what their buying behavior was on social media, and found a significant portion of people, greater than about 18%, were buying medical products via social media. We're talking Instagram, Snapchat, WeChat, Weibo, the various messaging services. And of those that did purchase those products via social media, we found about 35% were buying COVID-19 medication, vaccines, tests via social media. That's lower than benzodiazepines or opioids or other products, which are really high on social media, but still represents a major concern. And I think an eye-opening shift in consumer behavior for those of us who are doing work in this space. We can no longer focus just on the 35,000 web domains. Now we also have to focus on the social media platforms as another method of drug distribution and illegal SF medicine and vaccine distribution.
Eye-opening indeed. So where are all these fake vaccines coming from?
Well, you know, unfortunately, in this world, and as my colleagues know, my co-panelists, the kind of the best case scenario when it comes to these types of SF products is that they're diverted. In fact, they're actual real product and they're just stolen or diverted or achieved by some nefarious means, because at least you know it's real. Unfortunately, as was mentioned previously, with vaccines, oftentimes they rely on a cold chain, a really rigorous supply chain. And so even if it's real product and was diverted, I doubt it was kept at the right conditions the entire time. And so it does lose the effectiveness that you rely on. That represents, at least in this world, the smaller proportion. What I mean is that diverted product is really anecdotally probably fairly a small percentage of the availability out there. The vast majority of products found online are just absolutely fake. You know, they don't contain any of the active pharmaceutical ingredient. There's no real benefit to them. And when you think about vaccination as a fake medical product, it's really hard to detect because, you know, naturally when you get vaccinated, you typically aren't feeling the benefits of that right away. And it's only when it doesn't work do you recognize that you had a significant quality issue. And that's what makes vaccination so threatening, because not only do you not know it works, you really need it to work because now you have a public health emergency. And so we're seeing this growth and emergence of fake vaccination available via the internet worldwide.
Thank you, John. Those are great data points. I encourage our audience to look at the chat screen for the study that John was referring to on purchase of prescription medicines via social media. Take a look at that very interesting study. Thank you so much. So we now move on to Oksana. Oksana, you are the founder of the first academic chapter of Fight the Fakes, University College London. Could you share your thoughts on what is needed to scale up action to prevent falsified and substandard COVID vaccines from endangering people's health?
Well, certainly, I think some of our panelists have already touched on this issue. Adam, who is our chair of the Fight the Fakes Alliance, had actually referred to it as liquid gold. It could be described as the perfect crime because it is very difficult to prosecute. Pernette from the WHO has also highlighted that there is a lack of data and that we need more research to fully understand the problem between, and of course, the very central differences between substandard, where there is a poor quality issue at hand, where it's issues with the cold chain and storage, but legitimate manufacturers, and falsification, where this is a criminal activity with the intention to deceive people about what is actually in that medication. Currently, legislative factors mean that it is police resources, etc., are stretched and limited. It is difficult to be able to actually prosecute people who are tied with this criminal activity. We saw that since the beginning of the pandemic, the UNODC, which is the United Nations Office on Drug and Crime, has reported a 5 times increase in the number of cyber crime that is occurring. And the fact that in many countries we had initially lockdowns, supply chain disruption, even GP surgeries were closed. People turn to the internet sometimes unwittingly, trying to fill their supply of a range of medications. PPE, protective equipment, was not available. Falsified diagnostic tests. Like today our theme is on vaccines, but all COVID-19 products, and Pernette will have some of the exact statistics on this, have been falsified. We know that when hydroxychloroquine received a lot of media attention, over 300 hospitals across Cameroon had reported identifying falsified medical products, fake hydroxychloroquine. This is when there was still some perception that it could have some benefit. And also the profits that underlie this criminal activity. It far surpasses even the sale of illegitimate drugs, of illicit substances, things like heroin. People can make a lot of money by profiting off of fear and misinformation. Misinformation has been almost a parallel pandemic throughout this entire well, for the past 2 years. It has really been difficult to stamp out. The science in developing the COVID-19 vaccine has been clear, and our scientific path, even with the challenges of the new variant, Omicron, are also, it might take some time, but there is a plan. However, tackling misinformation and the damage on trust that it inflicts is actually much more complicated. And from that review, when getting to the heart of your question about how do we tackle this problem, it has to be across all sectors. We need to be working very closely with UNODC, with Border Patrol to be screening packages. We need to be looking at the role of the internet and big tech, social media companies like Facebook, Twitter, that operate sort of in a black hole of regulatory absence. And we need to catch up to how people are purchasing their medicines, the modern consumer demand that is there. I think John really powerfully illustrated a problem that's not being looked at carefully enough at the moment as one of those things. And then, of course, education and awareness. So the entire Fight the Fakes membership this week for Fight the Fakes Week is kicking off various awareness raising right from bottom grassroots. So here at UCL, we're also ensuring that our curriculum, every pharmacist day one will know how to report poor quality medicine, a falsified medicine, a medical product, and also have that conversation with their patients about where are they purchasing their medicines. And so all the way up to heads of government making key decisions about supply chain and the technology that will be needed to secure that, whether that is through new methods such as including a blockchain, towards working with partners such as GS1 on harmonizing track and trace of medical products. So WHO has a fantastic roadmap in terms of how to improve reporting, how to improve education, but it has to be through every sector, including the private sector. And as our USP colleagues have highlighted, quality is an equity issue as well. We know that there have been 30 times more vaccines given to high-income countries than low-income countries. And 68% of all vaccines have been delivered in just 10 countries. In the vaccine equity gap that has been left, criminals can operate to deliver to those who are desperate to access products. And when we looked at the second wave in India and the shortage of oxygen cylinders, very tragically, people gave up their life savings sometimes to try and purchase hugely inflated prices around oxygen tanks, which turned out to be completely empty cylinders, and people were dying. So it's not just about one type of medical product, although the vaccines are very, there is even more complex factors to consider around quality and supply chain. It is all COVID-19 medical products and beyond. This is a wider issue that requires cross-sector collaboration.
Thank you, Oksana. So as you were mentioning so many great examples of where this is really dangerous and, just the magnitude of what we're dealing with. It reminds me of the Delta variant rage in India and the oxygen crisis. And we were all, running helter-skelter to help out those who need it. And even so, it's not just one product, but even for vaccines, which have been very tightly controlled by the government. In India, we needed an app and everybody had to register through the app. It was slowing down the process, but still the government insisted on certain procedures. Even there were instances where in Mumbai, there was 2,000 people who were administered fake vaccines and in a community. And they organized a camp and they started vaccinating people and it was found to be fake. So it brings out two different kinds of issues, right? One, you think you're protected, as several of our panelists already mentioned. You think you're protected and you're not. So that leads to other danger of actually contracting the disease or passing it on to other people. But there is also, what if the vial actually had something harmful? So as we saw in remdesivir, so people spent crazy amounts of life savings or loans or debt to buy a vial of remdesivir on the black market when remdesivir was considered the save all, be all, end all around April, May timeframe. And there were many, many instances of fake remdesivir that was caught by the authorities. So you're absolutely right. All of this is critically important. Now, do you think some regions are more affected than others in this situation?
Absolutely. I think that we do see regions that have limited regulatory capacity. So they may not have enough resources to attribute towards maintaining security of the supply chain, and also where there is a lack of access to medical products. Both of these things are where there is the greatest opportunity for either falsified products, diversion, as John also mentioned, to occur. So we do know that particularly in a pandemic, we have to have a global view. So although high-income countries are not immune, there are, even here, where in the UK, there was a case of an elderly woman in her 90s who had a person come into their home and inject a fake vaccine, despite the fact that it is very well advertised that there is no such service and that this is illegitimate. But it occurs everywhere. But we do know, of course, as I mentioned, there is only one low-income country that is on target at the moment with vaccination for getting 10% of their population protected. 1 in 4 health workers in Africa currently do not have even their first dose of vaccine, which means that they're entering high-risk environments without any protection. So of course, these are all interconnected. If we do not solve the global vaccine distribution problem, then we will see more variants arise, but it also creates this market opportunity for nefarious actors to exploit. So we need to ensure that we are supporting and harmonizing regulatory bodies within these identified regions, which tend to be low and low middle income countries, as well as looking at what the legislative factors, what punishment we can bring in to deter people from pursuing this very profitable activity. And then also looking at what is the role of high income countries to ensure that we are all protected. Pranette said that, again, very eloquently, that our global supply chain is all interconnected. And because of that, that risk in another part of the world that seems so far removed to us will end up on our doorstep sooner than later in a crisis scenario. So a part of this is going to be even looking at what financially we can do to ensure that there is a more equal distributive process, as well as looking at harmonization. And so things like the African Medicines Agency that has been newly established is a step in the right direction to help with that. But we also need to ensure that we help countries get financed for success as well. So various things that we can all do to help contribute to this. Raising awareness and education is one aspect that our UCL Fight the Fakes chapter has been very passionate about in delivering, but it is only one step, and it's certainly not going to solve the problem.
So what solutions are accessible and ready to implement, whether they're technologies, strategies, law, what is ready for implementation?
Well, if we look at even just ensuring that there is a global reporting system, so ensuring that our healthcare workers are reporting now, because that is already running. So that is one thing that I think we could get all healthcare workers mobilized around this, particularly during Fight the Fakes week. In terms of calling for access, that's making sure that our decision makers are sharing vaccines that already exist. A lot are being, unfortunately, even wasted. We are not managing to even use the supply in high income settings. And so that is, the data on that, I don't think is good enough to say exactly what percentage. I think there are a lot of deterrents from it being reported, but we really have to ask a moral question. If we're throwing away mRNA vaccines when there are healthcare workers in other parts of the world that aren't even getting their first dose, it means that we haven't done the logistical operation correctly at this stage. And although it is difficult, that's not to say we shouldn't be trying to ensure that we are getting those vaccines where they need to be, including sending, if needed, training alongside that. So it has to, I think Pranette also mentioned issues around technology transfer, even human resource transfer would be things that we could do today. So you had asked me the question, what's ready to go? Well, we've got the vaccines. The more the legitimate ones get out there, the less the fake ones will end up harming other people all over the world.
That's a great point. And I think if it wasn't as obvious until recently, the Omicron variant makes it very obvious that we are not safe until everyone is safe. And so absolutely getting the vaccines to the right places and far away places is critical. Thank you. Thank you so much, Oksana. I will now invite Maria to speak. Maria, so happy to have you join us to represent Latin America and share a little bit about what the situation is in Latin America when it comes to substandard and falsified medicines, and in particular related to COVID. And, you know, some of the key messages as a representative of the industry as to what we can do to solve the problem.
Yeah, thank you to all, and good morning, good afternoon, good evening to the audience around the globe. We in FIPHARMA, we are really thrilled to participate in this week. We have been, following all the things that you are promoting this week, and we are really committed to support this cause. Basically, Latin America is no exception in this global trend. According to the recent Pharmaceutical Security Institute study released in 2020, Latin America experienced an increase in counterfeiting, illegal diversion, and major theft. A 45% increase in new incidents, and also counterfeiting increased by 29%. This was partly fueled by the pandemic, but overall incidents involving COVID-related medicines were up to 160% in 2020. The report also documented a 61% increase in illegal diversion incidents in the Latin American region. Basically, in the Federation of Pharmaceutical Companies that we represent in Latin America, we firmly believe that it's important to take a systematic approach to ensure the issue of falsified medicines products is tackled effectively. This means that a layered approach encompassing different complementary measures should be preferred, and that adequate communication and coordination between relevant stakeholders are imperative to achieve a successful strategy. We firmly believe that one of the things that we must pursue worldwide is to keep on going on international cooperation between states is fundamental in the efforts to combat counterfeiting and the fraudulent marketing pharmaceutical products. Mutual assistance, permanent dialogue, and the exchange of information should be the rule among the countries of the region. Cooperation must transcend the political tensions between governments. Sometimes long-term technical and effective alliances must be forged, allowing authorities to combat this illegal market that endangers health of patients in Latin America. Also, we think that, as my colleague panelists have been mentioning in all their interventions, that an integrated multi-stakeholder dialogue articulating authorities and the private sector is essential to work collaboratively on the different edges of this problem. We, in Colombia, for instance, we had living and based here in Colombia, and I have the opportunity to follow an initiative of the National Entrepreneurs Association that is called Proyecto para la Usurpación y Falsificación de Marcas, that has resulted in a very successful initiative that has a robust roadmap that has advanced the country into a very successful public and private cooperation, getting a robust regulatory framework for punishing offenders, effective prosecution, and constant awareness campaigns. That's something that maybe other countries in the region can follow up on. And finally, as all my other colleagues have been also pointing out, it's important to keep on working on public awareness and education to addressing the impact of falsified medicinal products. Effective awareness campaigns, equipping public officials, patients, media, and general public with the knowledge to help and avoid this threat and safeguard our health. Finally, in FIPHARMA, we will keep collaborating. We have our partners in IFPM8 and Fight the Fake Alliance, raising this awareness about the dangerous impact of falsified medical products. And I think at the end, we all have a voice and a role in this issue, not only in this important week of the year that brought us here today, but also on an everyday basis, calling for us to work together and keep strengthening the efforts and the collaboration of this great coalition.
Thank you, Maria. You mentioned Colombia case as a best practice. Could you share what the key success factor may have been there?
Well, I think that, and as my colleague from the WHO just mentioned and others mentioned, I think trust is the basis of a good public-private collaboration. This work in Colombia began in 1998, and they have, envisioned a long-term agenda. And they are working parties that have gained trust from each other, learning from mistakes, helping each other, and working for the same cause with a hard commitment, and truly connoting that they are in this together with a long-term view, and beyond governments and beyond policies and, just institutions working together in the long run towards this common cause. So I think that if we can have all that at the local level, good partnerships between public and private sector and all other entities. That's the way forward, because illicit groups are there, and then of course taking advantage of this opportunity during the pandemic, because as we all mentioned, and we know that products are not there for all of us, and we have access limitations. So that's why they got an opportunity. So the idea is to keep working together and also including all the partners and the private sector into the collaboration.
So trust being the foundation, and it's something that really builds over a period of time. So if there is a best case situation that happened now, it's because it's been in the works for decades, it looks like, and with a common cause and a commitment and learning the hard way. Maybe there were mistakes made, there were learnings there, and all of that resulted in being able to work together in a pandemic with that underlying trust that has been built over a period of time. That's great. That's a great example. You mentioned a few pillars that Latin America has to do right now to address the issue. Is there any other line of action that you would like to mention?
Well, I think it's also an opportunity for paying attention and working as well in a collaborative way towards pharmacovigilance. Is one of the key steps to ensuring the safety of the medicines and the vaccine, and encouraging all of us, regulatory authorities, private sector, patients, community, and all of us, in order to understand that we need to effectively monitor the safety of the medicines and the vaccines throughout the life cycle, especially critically for the vaccines, because they are complex products. And we, as all of us, we have been, telling the audience, keep working on raising awareness about the importance of pharmacovigilance, support WHO efforts in calling and strengthening national pharmacovigilance system, spread the knowledge of good pharmacovigilance principles, ensure key players like patients, doctors, regulatory authorities, and industry contribute to pharmacovigilance reporting. It's not only something that the industry must do, but it's a common cause that we all must undertake in order to help to get the data and they have the authorities with enough information in order to take action and measures towards strengthening the quality of the products in the market.
Thank you so much, Maria. With that, I think we can open up the questions to Q&A. Any questions from the audience to the panel or any particular members, please feel to type in. I see one question there that says, how can we know that the vaccines that we took are not fake in case we don't have trust in where we got the vaccine in our government or country? Any panelists?
Raising my hand the old-fashioned style.
Please go ahead.
So we know that falsified vaccines are something that create a lot of anxiety and a lot of alarm. And at WHO, we always try to make sure that whenever we communicate about substandard or falsified vaccines, we try to balance the alarm versus alert. You want people to be aware and alert to this issue, but you don't necessarily want them to be alarmed. Now, the vast majority of reports we have received, we have seen, actually in all the reports that we have received, we have seen that good procurement practices have not been respected at one point. So if you're procuring vaccines from unsafe sources, then you're not displaying a behavior that is safe. And that's when you should probably be asking yourselves a little bit more questions. If, however, you've received your vaccinations from the institutionalized center at which things have been done, there is a greater likelihood of you having received a proper vaccination shot. So I understand that, you know, we're just saying, oh, it's really important to be aware of substandard falsified vaccines. They can be at all levels of the supply chain. And now I'm saying, don't worry too much. it's a question of likelihood. It's a balance of probabilities. The other thing that you can do if you're worried about it is you can ask your healthcare provider to contact the manufacturer and check whether the variable data corresponds to genuine manufacturing records. So that means, does the batch number, expiry date, and manufacturing date correspond to the manufacturing details? Afterwards, of course, there's a lot of pharmacovigilance that you can do. You know, have you had any unexpected adverse reactions after receiving that shot? You might want to go, if you're really worried, you might want to go for a serological test. And if your serology is very low, well, maybe there's something wrong with the vaccine. So there's a lot of different things that you can do, but I would recommend, first of all, no need to panic. And second, check with your healthcare practitioner. And third, always procure from safe and reliable sources.
Thank you, Pernette. We have another question that is specific to if someone has a product to authenticate vaccines and it's a new product, where can they present it to for distribution delivery to be considered? So I guess it's about innovation and people coming up with different products, but what's the right way to introduce these and who should they talk to?
Shall I take this one again, or does anyone want to?
Sure, go ahead, Pernette.
Okay, so the world of detection devices is a very dynamic market. WHO is working with a lot of other academics to assess the different technologies and devices, because you might have multiple devices which all use the same technology, and you might also have different technologies. I would recommend that you contact the different academics who have been doing literature reviews and comparative studies on the field screening devices. Obviously, WHO cannot recommend one commercial device over another. We will be working with member states and other partners to identify what is the most suitable screening device depending on its user and the context in which it is used. But we can't promote one device over another. I'll put into the chat a couple of links on some comparative studies that have been done. USP and Oxford in particular, we have worked with them. The first, we're working on comparing the different technologies, and the second, we're working on comparing the different devices. And there's been some absolutely fantastic work done there. So I would recommend that you reach out to those academics as well. And WHO is, of course, continuing to observe that market, but I just really want to put the caveat that we cannot recommend a commercial brand over another. And just on that point, Sirisha, if time allows, I just wanted to come back to a comment that was made about risk-based post-market surveillance.
Please go ahead.
So in the regulatory world that we live in, you know, one of the ideas of the moment, I may say, is that we're shifting from you know, regulatory compliance and reliance on very strict standards to integrated risk-based approaches, because all the markets are so dynamic that you have to constantly adapt your safety and quality assessments to the real world. And this is something that is also done with risk-based post-market surveillance approaches. And the risk-based post-market surveillance approaches straddle the prevention pillar and the detection pillar. So it's supply chain integrity, but also improved detection and reporting capacities. And the link I wanted to make with this question on the devices is it would be really interesting to explore further which screening devices are more or less suitable for the different points of verification in a supply chain. So you know that within a supply chain, there will be different weak links, different points of vulnerability, and you need to oversee those weak links more than the other aspects of the supply chain, because that's where you're most likely to detect substandard or falsified versions. But depending on where you are, and depending who is using the screening device, you might find that some tools are more or less appropriate. So if you're in the field, somewhere rural, you definitely want something that can give you an immediate result, and that doesn't have to be charged very often, or where the library of references is immediately up to date. If, on the contrary, you are in a setting where you can verify at the point of importation and you can do a little bit of wet chemistry, you might want to use different screening devices. So there's a lot of statistical analysis that's done on where are the risks in a supply chain and what are, you know, the products that you have to sample so as to best identify the risk. But you also have to identify the points of verification, and you have to understand how to verify them in line with all the other supply chain integrity tools that we have, including traceability. Over.
Thank you, Pernette, with that explanation of risk-based PMS. I know USP is also working very closely with WHO in several countries. I also see that Paul Newton has shared that they're working with multiple partners on this subject. So Adam, you can reach out to Paul. He has kindly shared his email ID and links to other reports that they have generated. Thank you, Paul. Okay, so I have another question to all of the panelists, anybody who would like to take this. So while the issue is a global issue, we are dealing with substandard and falsified COVID medicines and vaccines across the board in various countries. Are the solutions to be applied the same in all the regions, or is there a significant customization and adaptability that needs to happen in different regions? Are solutions similar for applicability? Anyone? Oksana or Pernette?
I'm happy to chime in.
John, yes, please.
Quickly.
Thank you.
My pleasure. So it's going to be a really generic answer, but I think it's one that we can build off of. One is there are foundational elements to ensure that the risks are reduced. And when I talk about foundational elements, I'm just going to echo the comments that my other panelists have made around incident tracking, education, capacity building, availability, access. These are foundational principles to ensure that we reduce the patient safety impact of SF and otherwise counterfeit vaccination. Now, if we just take education as an example and capacity building, we know that we need to do it, but how we do it and how we execute it is definitely going to change based on regional need, because our lower and middle income countries have very specific struggles related to that compared to some of our higher income countries, say the United States or United Kingdom. And so although we do need education everywhere, we need to roll it out in a way that's most effective for the population that's being impacted. And so that's why I know it's a generic answer, but hopefully it's one that my colleagues may want to build on. Is we have these foundational principles, but there needs to be target execution of these strategies based on regional need.
Thank you, John. Would our panelists also want to comment on this last question? Each of you, the same question that John has addressed. Any comments from each of you?
I would just stress out and also, re-emphasizing what I have mentioned before, is that the importance of trust. And here, the pandemic has shown us that without the private sector, without the compromise or the commitment of the regulatory authorities, without the willingness of innovators, without the physicians, without the health workers, without the health personnel, we couldn't be in another situation. And of course, on local, the local situation is different everywhere. But the basis of all those achievements at the local level and at the regional level, at the global level, are the foundation of cooperation and talking to each other and listening to each other and being able to connect towards the common goal of getting vaccines and medical products safely to patients around the globe. So basically, that I will stress out that from my point of view, that's something that the pandemic shows us that has worked well. So we need keep on doing it in the proper way, in a transparent manner, cooperating and listening to each other, but involving the private sector and involving the public sector into a nice dialogue. So I would say that we should continue on that way forward.
Great point. Thank you, Maria. Anyone else?
Yes, happy to add a concluding point around the fact that even before the pandemic arrived, we had problems with access to certain medications that are also strongly linked with falsified medical products. And the pandemic in many ways has exacerbated inequity across many aspects for people, and again, access to medicines being one of them. In the UK, Operation Pangea, actually their efforts to detect falsified medical products, they found 3 million falsified medical products worth £9 million with illegal online sales that was seized in the UK. And this is again because the spot checks at borders, etc., is such a tiny proportion. It's less than 2% of all packages that are actually inspected. So a lot of improvement could be made in this area, but it requires coordination and it requires a commitment. We've heard about the importance of private and public sector working together to come up with more creative solutions around ensuring that high quality medical products, whether they are COVID-19 vaccines or whether they are antimicrobials, antibiotics, get to the people who need them. So this pandemic is also an opportunity to think about how we can leverage some of the technological solutions around track and trace that we have used for different purposes and link it to the specific issue of substandard and falsified medical products. And there are many partners that are working in this space, and it's really important for us to be sharing and amplifying that work, particularly Professor Paul Newton's group that has done some fantastic research around substantial falsified medical products, and continuing to work together collaboratively to essentially prevent harm and loss of life. So thank you for your time. I'm going to have to jump off the call now.
Thank you, Oksana. Anyone else? Okay. If no other comments or questions, I can share key takeaways from this really rich discussion. I think we got a lot out of the perspectives and facts from our panelists. Okay, so we started off with Burnett and sharing about the importance of the need for data and evidence and how that becomes the basis of trust that several of our panelists have been referring to, because that in order to, while there's been such a focus on access and there's a need to address access issues such as manufacturing capacities and so on, Burnett highlighted how it's critical to also address governance issues, and that will build trust in government systems, public health systems, regulatory system, and all of this is critical to building of that trust, which seems to be the most important factor other than data, based on which all of the scientific work we do happens. And we had Yvette emphasizing that same need for data and reporting, and that there is a fear of hesitancy, and that should not be the reason for not gathering data. In fact, she highlighted that it should be a reason for more effective communication, and that the data reporting and analysis, as Burnett also pointed out, it actually builds more confidence in the regulatory systems. If you are able to prevent, detect, and then report and address, and all of that is transparent to the public, then you begin to build the consumer confidence in these systems. So, and she also highlighted, Yvette also highlighted how quality is fundamentally an equity issue, and it is showing up again and again. So it's not just access that is important. We do have to address governance. We do have to address quality. And without that, access is meaningless, because if what people have access to is substandard and falsified medical products, then, that is pointless. We then had John share very, very interesting statistics and information about what's driving consumer behavior, especially as it relates to internet. And surprisingly, there are just a very huge trend, especially of younger population, beginning to purchase medicines and treatments and even vaccines on not just the internet, but also on social media. We have a study that he shared. I think it's very eye-opening on what is happening as a trend, and for actors in this space where we are trying to work on addressing quality on monitoring internet and how substandard and falsified medicines may be being sold on the internet and illegal online pharmacies. While all of this is being addressed, a new focus has to also be on how to detect even what's going on in social media and how that trend is showing up and how dangerous it is, and how people can be gullible because there has been massive misinformation. We had Oksana point out, referring to Adam's introduction on COVID treatments and vaccines really being liquid gold for counterfeiters, because profiteering out of this has become a big focus for a lot of nefarious players, given the fear that is gripping the globe right now, and given the shortage of these essential vaccines and medicines. They're really taking advantage of that fear, and we see the proliferation. There's also the fear of misinformation, which Oksana refers to as a parallel pandemic, the parallel pandemic of misinformation that has really spread. So Fight the Fakes week is addressing a lot of these. Over the week, there is several events planned. We encourage our audience to take a look at that, see what's coming up. The issues has to be addressed all the way from training of pharmacists on how they look at, how they detect, how they report on these incidents, encouraging conversations that our healthcare professionals can have with the consumers, with the patients, on where are they getting their medicines, where are they purchasing their vaccines, and understanding the sources and being able to report on those. And from there on, working all the way to the government when they have to make decisions. It will involve a lot of stakeholders. We have to mobilize several stakeholders, and she refers to how there has been, it really needs coordination amongst multiple stakeholders, including the government, because there is both the issue of substandard as well as falsified. Substandard is when we have legitimate medical products, but there is a cold chain, there is a way for storage, there's a way for distribution, and that needs to be addressed. So that is about the how a medicine can become substandard. But there's also this huge issue today of falsified and various ways to address that. We then had Maria sharing great facts about Latin America, and what the big highlight for me in Maria's conversation was how trust seems to be the foundation of what can work well. So there are several approaches she mentioned, and they do believe in a systematic approach, which really uses complementary approaches and looks at long-term vision. It's not something you can just fix in a day. It takes time to build this trust because you're going about it in a systematic way. And there is public-private partnership involved, which is critical for success overall in the system. And also that you would need effective communication campaigns with the right education, the right messages to continue to build that trust as a basis of success. So when we, asked our panelists of what they thought are common themes across the globe. I think John did a great job of highlighting the foundational elements, whether irrespective of which region we're talking about, whether we're high income or low income country. Yes, there are differences in what needs to be done, but fundamentally, the incident reporting is the basis, education is the basis. Capacity building also is important and critical, and communication campaigns as part of education. What exactly those messages will be have to be tailored based on locality and what the specific issues are of the region and the country. But fundamentally, these are similar across the board. And, you know, we continue to talk about trust as a foundation for all of this to happen. I'm also very glad to have heard Pernette re-emphasize the importance of risk-based post-market surveillance as one of the tools. And the pandemic really exacerbated many issues, including access to medicines, but falsified medicines, you know, there were millions of reported incidents, as Oksana shared. So overall, I think we have gotten a wealth of rich conversation out of the panel, and I think we all have lots of work to do. Good luck to our panelists doing a great job in their respective roles and for taking the time out to be on this panel. We encourage all of you to continue to look at the events this week. The organizers for Fight the Fakes have done a fantastic job of putting this panel together. Great prep and organizing, as well as for all of the events coming up this week. Thank you so much for having me, and we look forward to seeing you in other events. Does anyone want to say anything, or should we close? We're a little bit ahead of time, maybe by a few minutes. We could all use a bio break. Thank you. Thank you, everyone. Really appreciate your time. Thank you to the audiences. Bye-bye.